Hello everyone, welcome. Today we're discussing behavioral issues in autism spectrum disorder, meltdowns, tantrums, throwing oneself on the floor, rule breaking, or stereotyped behaviors like hand flapping, spinning, and rocking. Let's understand these behaviors' origins, identify their causes to find solutions and help our children or teens, and help parents too, because seeing my child struggle without knowing why creates unbearable anxiety. But knowing the cause, the enemy, and how to fight it changes everything. I'm Daria Protti, a speech therapist in Turin and mom to a sweet child on the spectrum. If you're interested, subscribe and hit the bell. If you think this video could help someone, please share it. So what are the main causes of these behaviors? Observe your child and understand what triggers them. First point, pain. Rule this out first, especially in nonverbal kids who can't explain what's wrong. Studies show autism spectrum disorder has a high rate of gastrointestinal issues. Many scientists think gut problems may cause autism, citing the gut-brain connection. While that's a debate for another time, autism clearly has more gut issues, so watch them closely. Get to know them. Consider they might cry, scream, or fall down because they're in pain. They have bloated tummies, swelling in the upper and lower abdomen, pass gas, burp, have irregular bowel movements, go days without using the bathroom, or suffer from chronic diarrhea. So they experience chronic pain, or perhaps the crisis is linked to an acute phase where they feel particularly unwell, experiencing colic. If you think the problem is related to this, take action and consult a doctor who specializes in autism spectrum disorders. I strongly advise this as it's a very specific field and you need a doctor who's an expert in this area. There are also gastroenterologists who specialize in autism spectrum disorders. So if you think your child has digestive issues, consult a doctor. They'll run tests, provide a clear diagnosis, and offer treatment that should help your child feel better and prevent related behavioral problems. Another common reason is sensory processing difficulties. Our kids struggle to properly process external stimuli. Visual stimuli might be overwhelming, so they try to narrow their field of vision or struggle with bright lights. They're hypersensitive to sounds, covering their ears for loud noises or even constant background noise that, while not loud, drives them crazy and distracts them. Tactile sensitivity. They remove clothes, lie on the floor, take off shoes. Many stimuli together, lights, colors, noises, people in malls or supermarkets, can be unbearable for our kids, causing meltdowns. Some adults on the spectrum have made videos simulating what they experience when stimuli become overwhelming and they can't process them, trying to explain to others how they feel. If your kids have meltdowns in these situations, how can you help them? In the short term, remove what's causing distress, take them from crowds, turn off TV or vacuum, hug them, and help them through the crisis. For the medium term, consult a therapist specialized in neurosensory development. There are specific methods and therapies to help children process stimuli better and not be overwhelmed by them over time. Long term, consult a therapist specialized in neurosensory development. Specific therapies can help kids process stimuli better over time, reducing their sensitivity. Another cause of problematic behaviors, it can be related to spatial, temporal orientation. Children who have trouble understanding how the day is organized, what comes first, what comes after, why I'm playing, and now they pull me away and ask me to do something else I don't understand. Note, this applies not just to nonverbal kids, but also to children who may speak well but feel lost and can't pinpoint the source of their distress. They can't explain it, but when they're upset, it's up to parents to observe and figure out what's wrong. Why is my child throwing tantrums, refusing to do anything, screaming, or throwing themselves on the floor? If the issue is understanding the sequence of events, what's being asked, and daily tasks, one solution is a visual schedule. A Velcro board with images for school, store, and home is often used. The child knows what to do and removes each task as it's completed. This helps them stay oriented throughout the day. Besides, or instead of a visual schedule, let's talk to our children. Let's explain. Sweetie, now we've brushed teeth. Let's put on PJs, play 5 minutes, then it's bedtime. Maybe set a timer. Honey, 5 minutes left, then we'll tidy up. Daddy will carry you to bed. 3 minutes left, then we'll clean up together and go to sleep. Okay, time's up. Let's put things away and go. So, pain, sensory issues, space-time problems, watch your kids, spot the issue, ask therapists for help, make a plan. That's all for today. Goodbye. See you in the next video.